Welcome, everyone, to today's session of the Beyond the Diagnosis, a guide to adult kidney cancer survivorship, led by Dr. Berg. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the survivorship team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate our question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to you, Dr. Berg.
Thank you so much, Sierra. Good afternoon, everyone. Thank you for joining us, and I hope that this will be a nice overview regarding how to manage after a kidney cancer diagnosis. So we're going to get right into it. So my name is Dr. Stephanie Berg. I'm a GU medical oncologist at the Lenk Center for Genitourinary Oncology, the Dana-Farber Cancer Institute. So what is survivorship? I think it's something important to define. And how we define it, I think, is knowing that a cancer survivor is really from the time of diagnosis through the balance of his or her own life. And survivorship is how we say the start up from the point of diagnosis, recognizing the many people who live with cancer for years following diagnosis and can remain well with support to address their needs as they arise. And it really does encompass physical, psychological, and economic sequelae of a cancer diagnosis and its treatment. So here's our outline for today. I'm going to briefly start with a background regarding the types, risk factors, symptoms, perhaps discuss some of the treatments that you had for your kidney cancer, including surgery, radiation, surveillance, and if you received immunotherapy, some long-term side effects that may happen after receiving immunotherapy, and some nutrition guidelines for survivors and those that may be diagnosed with chronic kidney disease. And then an overview of just practical tips for caregivers follow-up and our support resources at the DFCI Survivorship Clinic at the Blum Center. So here's a little bit about kidney cancer. So what is kidney cancer? So renal cell cancer is a disease in which cancer cells are found in the lining of the tubule. So we have two pictures right here. One is of a man and one is of a woman. And it is the most common type of kidney cancer in adults. We know that each person is born with two kidneys, usually. One is usually on each side of the backbone above the waist. In the kidneys, there's tiny tubules that filter and clean your blood. They take out the waste, and the kidney's main job is to make urine, and that urine passes from the kidney through a long tube called the ureter right here into the bladder, and the bladder is what holds your urine and passes it through the urethra to exit your body. So what are the different types of kidney cancer? So we have the main type, which is called clear cell renal cell carcinoma, which is about 70% of the cases. And then we have the other types, which we give a general label called non-clear cell kidney cancer, with the most common of those being papillary renal cell cancer, which is in 10 to 15% of cases. And then there's another type called chromophobe coming in at about 5%. And then there's other rare types I've listed here. So it is really important for you to make sure when you talk to your doctor, if you've been diagnosed with kidney cancer, after a biopsy is done or after your surgery, what type you might have, because there are many resources online for the different support groups for each type of kidney cancer. Let's see. Okay, it's not advancing. Let me just give you a... All right, here we go. So what are your treatments that you might have had for your kidney cancer? So surgery is usually the mainstay of treatment for localized kidney cancer. Sometimes you can have a small mass or a tumor when it's proven to be cancer. You can use something called ablation. There can also be radiation therapy that you could have had for your kidney cancer, or there's something inside the kidney. Or sometimes we get referrals where someone said that there's something growing in your kidney and you might be recommended for something called active surveillance. I just put some examples up here where, we can see that, depending on the size of your cancer, like for instance, the size of an apple of stage 1 cancer is about 7 centimeters, like the size of an apple. And then a stage 3 cancer is just showing a little bit more invasion and doing more things inside the kidney. So there is different stages that one gets assigned, after surgery is done. So what is a nephrectomy or kidney tumor removal? So if you were diagnosed with kidney cancer, I'm sure you met with your urologist, and that's the type of surgeon that operates on the kidney, the bladder, and the ureters, the prostate. But a nephrectomy is a term that we use for having removal of your kidney. So there can be a partial nephrectomy, a simple nephrectomy, or a radical nephrectomy. And that's really determined by your urologist at the time when you were first diagnosed, if there was something growing inside your kidney, how much surgery that you need. And there's different ways that they would classify what's the most appropriate to remove that mass and what happens afterwards. So again, they would have told you what you had, and we can see here that most often they try to do partial nephrectomies where if it's small and localized, they can keep part of your kidney, or they have to remove the entire thing and some lymph nodes because of how they look in your pictures, what is they find, and making sure that they can get out all of the cancer that they can see. So what happens to you after your kidney is removed? So I'm sure you might have been told this, but I just wanted to reiterate that a person can live with one part of one working kidney, and their other kidney will adapt doing the work of both kidneys, since the one that was removed, or maybe it wasn't working. So sometimes, again, you might have received radiation therapy afterwards, or there could have been something if you meet with your urologist and if they told you to meet someone like me, a medical oncologist, they think that your cancer has a high risk of returning. So you might be a candidate for something called adjuvant treatment, which is what we say after you have removal. And what we use is something called immunotherapy. That's what's approved by the FDA. Here's a little bit about radiation, which again, we don't use often in kidney cancer, but it's still something that we can recommend. And what radiation does is that it not only kills or slows the growth of cancer cells, but it can affect healthy cells. So again, there's some damage that can happen to these healthy cells, but it hopefully is temporary and it can come back. But it could be another modality that someone has told you, one of your providers, that you might need after surgery for your kidney cancer, or for again the main cancer that was found in your kidney if you are not a candidate for surgery. And it can still be extremely effective. Well, immunotherapy is something that I give. So right now we have one medication that is approved by the Food and Drug Administration that has shown to provide an overall life prolonging benefit for certain men and women with stage 2 or 3 kidney cancer. And this is called pembrolizumab, and it's a form of immunotherapy. So immunotherapy is something that we recommend for, if you qualify for it after a discussion, you would get it for 1 year. And so this is, again, you will be told by your medical oncologist that this is actually appropriate for you. So if you haven't been told that and you're wondering if that was something you should have gotten or you need to get, it would be really great that you inform your medical oncologist that you've heard about it and that you just wanted to find out more if it's something that should be done, and to talk about it. The thing about immunotherapy is that it is something that we use to treat more advanced stages of kidney cancer, so it can have a lot of long-term side effects. So again, most can occur within weeks to months, but there are late effects that can develop months to years later. So I've listed some of them here, which is something, again, before you started your treatment, or if you're going through your treatment right now, there can be side effects related to your skin, like a itchy skin or a skin rash or skin color changes. There can be hormone related effects like your thyroid function to make you feel more tired or gain some weight or feel cold. Maybe adrenal glands, which sit above your kidney, which can lead to weakness, changes in your blood sugars, and then maybe inflammation of a gland called your pituitary gland. This is something that we know about immunotherapy. Remember, your doctors and your providers will always ask you these questions during your treatment or even afterwards to make sure that they're understanding if anything is happening to your body. There's also things that can happen to your digestive system, like loose stools or diarrhea, liver inflammation, even effects to your other working kidney. So that's why, we ask to get a lot of blood work during immunotherapy, after you've had kidney surgery, muscle and joint effects, and lung-related effects. So what are the other types of kidney problems that can occur? I think it's important, being a kidney cancer survivor, especially if you just have one kidney left, what to know about, especially immunotherapy. So again, immunotherapy, if you do get it, you can get an inflammation of your immunotherapy, but there can also just lead to, something in your other kidney if it, when it's working, to really be mindful of for the rest of your life with your team is, making sure that if you develop something called chronic kidney disease, certain medications that you might be on, is it safe for someone that has one kidney or maybe 1.5 kidneys or 1.2 kidneys that are left? Or is this going to be healthy and okay for me? And then also, a risk for maybe diabetes or, something else. So it's really important to understand that living with one kidney is completely safe, but you just have to make sure that talking with your doctors about starting certain things to make sure that that kidney remains protected, because you might only have one left. So what does happen? So, a lot of times when we talk about chronic kidney disease, it happens not just immediately, it's over a period of time. And especially with immunotherapy, it is something that if you did get adjuvant immunotherapy or adjuvant pembrolizumab after your kidney cancer surgery, that, your medical oncologist will follow you for many years, making sure that we don't see these late-term side effects, or and if we do see them, help you manage it and make sure that they're aware of it. We always check the kidney test regularly. We check your blood work and we can send you to a kidney specialist early. And then really all this early detection and management helps improve any recovery if there was damage that may have happened. So what it is that I always try to emphasize that if you have any new symptoms, even after surgery or during your immunotherapy, like you're not making as much urine, you have some tiredness, and please tell your providers, even if it's many, many years later. It's something we want to emphasize as being a survivor and having these treatments, that you want to keep on, keep your body aware of it, because again, these can have long lasting effects. And even just after surgery, just to make sure that we keep that other kidney healthy. So what about nutrition? I get this question asked a lot because, again, living with one kidney, you always have to ask, is there something that I need to change? So it's something generally that we just have to consider about supportive healing and recovery after your surgery or even your radiation or your ablation, and really making sure that we can prevent or manage if you do develop something called chronic kidney disease. And we do have available at Dana-Farber, and hopefully wherever you're at, is that a registered dietitian can really help tailor any individual nutrition plans, based on kidney function and perhaps other health conditions you may have. And if you have been diagnosed with CKD, there are special dietary restrictions that you may need to follow, especially if you do have a kidney specialist, and they're called nephrologists. This is just an example of some chronic kidney disease diet general considerations. So about looking at, your protein levels, your sodium levels, phosphorus, potassium, and fluids. The reason why these are listed is that your kidney really, as I explained in the beginning, does help regulate a lot of these elements in your blood. So when you do have one kidney, it is mindful of what you're putting in to make sure that your kidney is healthy and can process everything appropriately, because we want to keep these levels even in our blood so that we can not have complications of perhaps a low phosphorus or a high phosphorus, a low sodium or a high sodium, etc. So it is something that we want to consider after discussing with your nutritionist and your nephrologist, or even your primary care doctor or your medical oncologist like me, something to talk about during your visit to make sure that your diet is appropriate. And then even about protein intake, I think is something really important that our team here emphasizes about, you might need to have some protein restrictions, but you also don't want to have too little protein to be malnourished. So these are really good points, I think, to talk about with your provider if this is something that's needed for you, post-surgery, if you have kidney disease, about what is important in your diet to make sure that kidney, what's remaining, is healthy and we can keep it functioning to the best of its ability. This is another slide about, post just having surgery, even though you have no evidence of damage to the kidney, they might recommend you maybe a reduced protein intake, but again, you need protein as well for healing and muscle maintenance. So just something to bring up, and I do encourage anyone that's had kidney surgery to talk about it with their urologist or their primary care doctor or their surgeon if you have an opportunity to speak with a dietitian or a kidney cancer specialist, just about anything that you might need for your care moving forward during, after having your procedure. So what are some follow-up testing after treatment for kidney cancer? So again, what is the basic information you guys should know? So survivorship doesn't actually just include cancer surveillance, but it's also monitoring. I've been talking a lot about chronic kidney disease, but it's also cardiovascular disease and other long-term effects. So there really is a coordination that needs to happen between your medical oncologist. If you have one, it would be always a good idea to get one on board if you've had kidney surgery so we can be part of your team. We're always happy to be part of that. Your urologist, if you have a kidney doctor, and your primary care. So a lot of the tests that we do as medical oncology and urology is really done as similar to what was looking at in the beginning to diagnose or stage that you had a tumor growing in your kidney and whether or not, how long we should do it for, what are these checkups, and what is your new normal, or as we call your action plan after your surgery, and if you, again, received the immunotherapy. So these are our guidelines. These are national guidelines from the National Comprehensive Cancer Network that all oncologists really follow in the United States to really make sure of what we know for our patients that have had a partial or radical nephrectomy, looking at history and physicals, laboratory tests, again, that I said to monitor for, chronic kidney disease, your heart, your electrolytes, everything like that. And then imaging. So we do recommend that there is a period of making sure that, the cancer does not return, where we do imaging of your abdomen and your chest. And we have some timelines followed up here. We do put limits about the years. We don't want to expose men and women, forever per se with, CT scans. So sometimes that's why we could recommend an MRI scan, which isn't, a radiation exposure versus a CT. But it really is, a discussion to have with your doctor. What would be the right test for you? And then we go up to 5 years. Sometimes that could be extended beyond that, but the standard right now is 5 years. That goes the same for a stage 2 cancer. Remember, it's always good to ask your team what stage you have after you've been diagnosed. And we have a little bit of a different schedule. And it does say that there could be a more rigorous schedule, meaning maybe instead of yearly, should I have it every, 6 months or every 4 months? And that's really something to talk about with your team about what is your action plan of how often do you need your tests? How long should I be doing this for? And moving forward after your treatments. I also put one for stage 3. So again, this is the majority of patients that we see that will get the immunotherapies if you were a stage 3 for that 1 year, as I mentioned previously. Again, a little bit more rigorous where, it says right here, every 3 to 6 months for at least 3 years, then annually up to 5 years. Imaging beyond 5 years is what we say is clinically indicated, meaning that you talk about with your doctor, should you be pursued with further imaging after that time period. It's really important to talk with them about that and what's appropriate for you, because we try to individualize all of our patients. We have our blanket national guidelines, but of course, this is a discussion about your individual action plan and what, again, is appropriate based off your stage and your pathology and, what's going on with you. So I just really wanted to emphasize that. And I just wanted to bring up too what a small kidney mass is and what is active surveillance. So really commonly, we know that there's a lot of reasons why you might have a CT scan for something that has nothing to do with how your diagnosis came up about with kidney cancer. And there is something in the medical terminology we call a small renal mass or a small kidney mass. There are thousands and thousands of people that have abnormalities in their kidneys. They could be a solid mass, they could be like a cystic mass. And it's really important that if you did have a scan that showed that there was something in your kidneys, that at one point really talk about that with your doctor and even perhaps get a urology referral to make sure that someone is surveying you, because sometimes these can grow and become kidney cancers. So what it is when we see small renal masses, I put a little example here about, a 2 centimeter mass, we think it's about the size of a peanut, 3 to 4 centimeters like a strawberry, and a 4 centimeters is like a golf ball. So a lot of the times when you do get a scan and there's something in your report that you notice that says a size, what we most commonly want really to be involved with as urology is if that mass is like the golf ball size, like the 4 centimeter size. But we still would want to know that if there is something in there, that you do have a plan. And if it's concerning that it could be not a cyst or something that could be a small kidney tumor, even at the size of a peanut, that there is someone that's following you, and not necessarily that you need to have kidney surgery right away, but that you go on an appropriate active surveillance program. So there is something that we do provide information regarding scans, every 3 to 6 months, and then every 6 months. So we kind of space them out so we can see if these are real and they're really growing, or is it just something that's there and we just need to watch periodically what it means? Because we know that kidney cancer can sometimes or often actually sneak up on a lot of people and they don't even realize that something happened to them until they come in and they had blood in their urine, or if they have pain, and who knows what was going on before. So I really wanted to emphasize that if you do have something or someone about active surveillance, if there's something on that scan you maybe ignored, that there could be something that should be evaluated by your doctor and getting on this plan if it's appropriate. So I wanted to bring that up. And we know that there is a small chance that tumors could grow or spread, but it is something that we emphasize active surveillance program and make sure that you're followed by, again, urology. This is where our urology colleagues are really important. And we follow a lot about these like small kidney masses, and see when it, do you need the surgery? Can we watch it? Have those conversations. So I wanted to bring that up. So just a little brief part about follow-up care at our Dana-Farber Survivorship Clinic. So our survivorship clinic is like once, your cancer treatment ends, if it's surgery, if it's immunotherapy, if it's radiation, or like I mentioned, ablation, you really should get a survivor care plan from your oncologist, and we can offer that at our clinic. So it's really important to understand, like I said, your stage, what you had, what else do you need, go over your imaging schedule, what else you can do to keep your body healthy, and, really make sure that you're on the right path towards long-term survivorship. So it's really important that I try to emphasize that all the patients, even doing once or just talking to your doctor, can you refer me to someone that can help me with this, is really important. And again, one things I like to say for anybody who's beat cancer and looking for long-term health is make sure you try to quit smoking, eat a balanced diet. Again, I went over that a little bit about living with one kidney and if you might need some diet adjustments. Discussing about, alcohol use and just staying active. I think it's the hardest thing that we can do. I know exercise, but it's more just staying active, trying to get those steps in. Can you do 30 minutes a day, 10 minutes a day? Do you listen to if you have one of those smart watches to stand up if you're working, just to keep your body healthy because you've been through so much, and we just want to make sure that you can stay healthy for many, many years to come. And then, here, especially at Dana-Farber, I put in here kidney cancer survivor needs. There's so much that involved in this, and it's something that it's not one person that does it all. There's a team that's always behind all of our patients here at Dana-Farber, and we're really here in the future. And I've put a link to our website here for more information. And, always happy that, we can help anyone that's been like this from another provider, and just providing that basic care and just giving them the information that they might need. So please feel free to reach out to us at any time. And thank you for your attention. That's it.
Thank you so much, Dr. Berg, for that great presentation. To our audience, if you have any questions, please feel free to put them into the chat. I didn't see any come in yet, but I'll give everyone a minute to put any of their thoughts or questions in, and hopefully Dr. Berg has a few minutes to answer them.
Absolutely. Thank you all for listening. Now it's a small group today, but I appreciate everyone being here.
Yeah, thank you everyone for joining.
I don't think we have any questions.
No, it looks like we don't have any. Well, thank you so much again.
Oh, wait, there's one. There's one.
What are some of the healthy foods that one can eat?
If we're going to speak specifically about kidney cancer, I think the one thing I was trying to emphasize was about protein intake and avoidance of maybe processed artificial foods because they could have a lot of sodium. But I think healthy foods, as my dietitians and everyone says, eat the rainbow. I think it's really important that you have a variety of, fresh fruits and vegetables. And I think there really isn't a limit to that, but it is something about just trying to incorporate that into, I know our dietitians say at least 2 meals that you have a day to have a good portion of something. And balancing fiber can be challenging because we always say because taking another supplement isn't usually the answer, right? I mean, that's the path of least resistance, but then you're, having to buy something and you're trying to do that. So I know they always emphasize whole grains, or at least, green vegetables have a ton of fiber in them. And, having that salad or something to really try to do that with every meal. Fiber, though, I mean, the easiest is also just getting something and eating it. But again, I know that's not the way that we should be doing that. We should be putting that in our diet. And they usually say, trying to do the whole grains and trying to do grains outside of the typical, rice, where you can do like the farro, sometimes the quinoa, some of the things that have more fiber in them, even like some nuts have fiber in them. It's really important to try to keep that in check, but it's trying to do that. They said at least 2 out of your 3 meals that you can have that, so you can have a good, bowel movement and you don't get constipated, especially if you are on treatment, making sure that, you're drinking a lot of water, because even having the water enough and that you're thirsty when you drink is really important, because that actually keeps your gut super healthy. I don't think we realize that enough, that we're not drinking enough, especially if you get constipated. That water is one of the things to really keep up on, to keep your bowels moving and stuff, along with fiber. Thanks, Hina, for that question. But I'm going to put the caveat, I am not a dietitian. It's just I'm relaying my dietitian's advice. And I know in our website, we have some information that you guys can get linked about the for nutrition services, right? I know it's on there somewhere, so please visit our website.
Dr. Berg, we had one more question come through in the Q&A. They said, thank you to everyone at DFCI for your help. Drinking water is boring. Is adding some flavored powders okay?
Yes, I think it's about when you add the flavor. I totally hear you about the sugar content. And I think there's a big movement where there was a lot of, there's been a lot in the news about artificial sugars, what is good and bad. And actually, our dietitians really do like recommending, if you like actually fresh citrus fruits, to flavor your water with lemons, limes, grapefruits, strawberries, berries, and like kind of let it sit. Or if you do the artificial one, that there hasn't really been a strict link that it's bad for you, meaning like some of the, like the Crystal Light things, but just be mindful that that is artificial. It's sucralose. And there's ones that are even flavored with like stevia, which is a really nice, more natural one, that you can use to flavor water. And that's something you also look at beverages that do contain high fructose corn syrups, but there are a lot more that are available that are more natural things to make water taste better. If like you drink even like the sparkling waters that just have like natural essence versus added sugar, but you just have to be really mindful of like what that sugar is. But again, there's so much on the market that you can like put little, drips in that can make water taste better. And I always emphasize drink when you're thirsty, because there is something, especially if you do have one kidney, that you don't want to drink too much water, because that can make your sodium levels really low. So we say drink when you're thirsty, make sure it's appropriate, that you don't want to be drinking excessively, because you might make your kidney work too much, and that could be dangerous. So that's something our kidney doctors always emphasize to me as well.
That is super helpful. Thank you again, Dr. Berg. And if there's any last questions, send them through. But really want to thank the audience for joining us. And thank you, Dr. Berg, for being on here today. This session will be recorded, or was recorded, and it will be posted on our Blum YouTube playlist. So you can take a look out for that in a couple weeks. But
Perfect.
Thank you, everybody. And thanks, Dr. Berg.
Take care. Have a nice afternoon. Bye-bye.
You too. Bye.